I once woke up the morning of a talk and could whisper at best. I stood over the kettle with a mug and felt absolutely helpless until one small sip and a quiet ritual helped my voice come back enough to get through the day. Today, we're unpacking those kitchen-first rituals that actually help, and importantly, what to watch for when something needs a doctor.
Welcome back to Earthy Remedy, Natural Remedies, Real Food, Better You. I'm Fiona, and with me as always is Samnang. Today, practical, clinician-vetted tips to protect and restore the voice. We'll teach 3 safe, kitchen-friendly demos, lead a gentle breath and warm-up, and give you a 7-day microtrial to test what works for your voice.
And we're joined by 2 clinicians so we can stay grounded in safety. Jordan Lee is our speech-language pathologist, and Dr. Maya Rios is a laryngologist. Hello, and thank you both for being here.
Thanks, Samnang. I'm glad to be here. I work with performers, teachers, podcasters, anyone who needs a voice that's reliable day to day. We're going to keep things practical and safe. Happy to join. My role is to clarify when a home routine is fine and when a symptom points to something that needs urgent evaluation. We'll emphasize the red flags so listeners don't delay care.
Quick housekeeping. We'll name urgent signs a couple of times in this episode. Things like noisy breathing or stridor, severe throat pain, coughing up blood, or hoarseness that's getting worse over days, or is present more than 2 weeks. If you hear any of that, please seek an ENT or emergency care right away.
Great. Let's dig in. Segment 1. What's actually happening when your voice feels rough or tired? Fiona, do you want to set the scene? And Jordan, can you explain the vocal fold basics for listeners?
When we talk about vocal fatigue or hoarseness, we're often describing changes to the vibration of the vocal folds and the surface lining that keeps them pliable. Hydration, mucus consistency, acid irritation, and mechanical strain all play roles. From a nutritional and fluid point of view, timing and type of intake matter. Sipping enough water during the day, avoiding heavy dairy before heavy voice days if that thickens mucus for you, and steering clear caffeine dehydration on those days can help.
Exactly. The vocal folds need a thin, lubricating layer of mucus to vibrate with minimal effort. When that layer is sticky, thick, or when the folds are swollen from overuse or reflux, your voice gets hoarse and tired. Small rituals can rehydrate and soothe the surface without hiding a deeper problem, and they work best when paired with limits on voice use and good breathing.
You said limits on voice use. What does that look like in real life? Teachers and parents can't just not speak for a day.
Right. It's about pacing. Reduce continuous speaking time. Add micro breaks, use amplification when possible, and swap long monologues for shorter, more intentional phrases. Track minutes of speaking during your heavy days so you can see patterns. That's part of the microtrial we'll give you.
Before demos, Maya, what are the limits and red flags from an ENT perspective? Help us be precise so listeners don't underplay warning signs.
Important ones: noisy breathing or stridor, severe throat pain, coughing up blood, or progressive hoarseness lasting more than 2 weeks. Also, if you suddenly lose your voice and have trouble breathing or swallowing, that's urgent. For anyone with underlying lung disease like asthma, inhalation-based remedies can sometimes trigger bronchospasm. Check with your clinician first. And if you have risk factors such as recent surgery, major reflux not controlled with meds, or a history of vocal fold lesions, seek specialty input rather than relying on home rituals alone.
Thank you. Those are the phrases we'll repeat. Now, a quick bridge. For anyone cooking along, here's the prep checklist. Cup or small pot, a small jar or mug, a clean spray bottle or neti-type bottle if you have one. We'll offer spray options. A fine sieve, and a spoon. Keep a notebook for the 7-day tracker in the show notes.
Segment 3, Demo A, the speaker sip. A single serve, low sugar, anti-irritant mouth and throat sip that supports mucosal comfort and voice ease. Jordan, will you walk us through the ingredients and why each one helps?
Yes. Ingredients for one single-serve speaker sip: 1 cup, 240 milliliters warm water, not boiling, but pleasantly warm. 1/2 teaspoon raw honey or 1/2 teaspoon maple syrup as a gentle humectant. 1/4 teaspoon fresh lemon juice, that's mostly for taste and to cut sweetness. 1/8 teaspoon ground turmeric for mild anti-inflammatory support, and an optional pinch, about 1/16 teaspoon, of ground cinnamon if you like warmth. The goal is a soothing, thin liquid that coats without leaving thick mucus.
Pause there. Jordan, who should avoid this sip?
If you have a known pollen or honey allergy, skip the honey and use maple syrup or omit sweetener. If you have difficulty swallowing or are at risk of aspiration, don't do oral coating rituals without guidance from a clinician. For infants, do not give this recipe. We'll note pediatric contraindications in the show notes.
Okay, step by step. Step 1, pour 1 cup of warm water into a mug. Step 2, add 1/2 teaspoon honey or maple syrup and stir until dissolved. Step 3, add 1/4 teaspoon lemon juice and 1/8 teaspoon turmeric. Stir. Step 4, let it cool just enough so it's warm, not hot. Sip slowly. Take 2-3 small sips, swallow gently, rest for 2 minutes, then repeat as needed, up to 3 times an hour during heavy voice use. Don't gulp. Small sips coat better.
I love the ritual language here. It's about slowing down, not just drinking something quickly. Any culinary swaps, Fiona?
If turmeric stains your mug, a dash is enough. If you prefer no citrus, leave out the lemon. If you're avoiding sweeteners, skip the honey. The warm water alone still helps. For vegans, use maple syrup. And if reflux is a concern, avoid late-night sipping that might trigger symptoms. Timing matters.
Segment 4, Demo B, a throat-friendly saline mist. Dr. Maya, can you explain why we use saline and the rules on sterile water?
Saline helps hydrate the mucosal surface gently and can loosen sticky secretions. Important safety points. Always use sterile or previously boiled and cooled water for any spray or nebulizer. For a simple isotonic spray, the conservative and listener-friendly dilution is 1/4 teaspoon non-iodized salt per 8 ounces, 240 milliliters of sterile water. Mix until dissolved, pour into a clean spray bottle, and label with date. Use within 24 hours and store in the fridge if you need to keep it longer, but ideally prepare fresh daily. Patch test by spraying once away from the face first, and wait. If you feel chest tightness, cough, or any breathing change, stop and consult your clinician.
Jordan, for people who worry about aspiration or young kids, what's your on-air caution?
Do not use throat sprays in infants or in people with known swallowing safety issues without professional instruction. Sprays should be used upright and gently. A couple of short sprays to the back of the mouth or pharynx while the person is sitting up. Nebulizers create finer aerosols and should only be used under medical guidance. For anyone with asthma, check with your provider before trying inhalation-based approaches, because even saline mist can sometimes trigger symptoms.
Quick dilution math recap. 1/4 teaspoon salt per cup, 240 milliliters. If you want a slightly more saline mix for thicker secretions, don't exceed 1/2 teaspoon per cup unless directed by a clinician. Use non-iodized salt and sterile or boiled water only.
Segment 5, Demo C, Short-Run Recovery Broth. This is a single-serve, voice-friendly broth to support mucosa and provide gentle nutrition when your voice needs rest. Fiona, read the ingredients slowly.
Ingredients for 1 cup of recovery broth. 1 cup, 240 milliliters, low-sodium chicken or vegetable broth, warm. 1 teaspoon grated fresh ginger. 1/4 teaspoon turmeric. A small pinch of salt if desired. 1 teaspoon fresh lemon juice or apple cider vinegar to balance flavor. Optional. For extra mucosal support, you can add a tablespoon of cooked pureed carrot for body and beta-carotene, but keep the texture smooth so it's easy on the throat.
Step by step. Step 1, warm your broth in a small pot to just below simmer. You want it warm, not hot. Step 2,
Stir in the grated ginger and turmeric. Step 3. Taste and adjust with a tiny squeeze of lemon if desired. Step 4. Sip slowly in small mouthfuls, allowing the warmth to soothe. If you make a batch, keep refrigerated and use within 48 hours. Discard if left at room temperature more than 2 hours.
Nutrition note. Low-sodium broth provides electrolytes and moisture without overloading with salt. If you're on a sodium-restricted diet, choose low or no-salt broth. And if you're pregnant or breastfeeding, check ingredient choices like herbal additions with your clinician. Avoid strong herbal concentrates.
Segment 6. Breathwork and vocal warm-ups. Jordan, lead us through a gentle 5-minute sequence listeners can do right now. Keep it safe for immediate practice.
Okay, we'll keep this very gentle. Find a comfortable seated position with feet on the floor. Step 1. Hands on your belly. Inhale quietly through the nose for a count of 4, feeling the belly soften. Pause for 1. Step 2. Exhale slowly on an S sound for a count of 6. Steady airflow, relaxed jaw. Repeat this cycle 3 times. Next, lip buzz. Take a small inhale and make a gentle lip trill for 5 seconds. Don't force it. If your lips can't trill easily, do a gentle humming on M instead. Repeat lip buzz or hum twice. Then gentle articulation. Say mama, mama, slowly on comfortable pitch. Then me, me. Each 2-syllable set is a micro warm-up. Finish with a yawn sigh. Fake a yawn a little to open the back of the throat. Then let out a soft sighing ah on a comfortable pitch. If anything feels strained or painful, stop immediately.
That felt really stabilizing. Even just the first breath cycle calmed my throat. Jordan, how often should someone warm up like that before a big voice day?
Do a short warm-up before any heavy voice use. Even 5 minutes helps. During the day, use micro warm-ups between heavy blocks of talking. And importantly, don't overdo the warm-ups as a way to push through fatigue. If your voice is tired, prioritize rest.
Segment 7. The 7-day vocal care microtrial. Simple rules. Pick one small change each day. For example, add 3 speaker sips spread through your heavy voice window. Or replace 1 hour of continuous speaking with amplified or written communication. Each day, record 3 metrics: voice effort on a 1 to 10 scale, hoarseness on a simple 0 to 3 scale, 0 no hoarseness, 3 constant, and total speaking minutes for heavy use tasks. If hoarseness worsens 2 days in a row, or if effort climbs above a 7, stop the trial and consult a clinician. Jordan, any additions to that framework?
Also, include one qualitative note. How did the voice feel after a task? Tired, scratchy, or smooth? That helps your clinician later. And use the downloadable tracker in the show notes so you have exact wording to bring to your appointment.
If your symptoms include any of the red flags we named, stridor, severe pain, blood, or progressive hoarseness beyond 2 weeks, don't wait. Use the clinician phrases in the downloads. Note duration, any voice use patterns, reflex symptoms, and your trial metrics. That helps us triage and make data-driven recommendations.
Segment 8. Safety, interactions, and clinician scripts. Fiona, give listeners the exact phrasing they can say in a message or at an appointment.
Here's a concise clinician script you can copy. I've had progressive hoarseness for X days. I'm a teacher, singer, podcaster, and I recorded these 7-day voice effort and hoarseness metrics. Effort, X out of 10. Hoarseness, 3 out of 3. Speaking minutes, Y per heavy day. I've tried the following home measures: hydration timing, speaker sip, gentle saline spray, and rest. Could we discuss whether this needs laryngoscopic evaluation or a reflex trial? Saying this gives your clinician focused, actionable information.
If reflux is contributing, acid suppressive therapy may be discussed with your clinician, but we don't recommend over-the-counter or prescription changes without medical oversight. And avoid concentrated essential oils near the face. They can irritate mucosa or trigger bronchospasm.
We promised a sensory moment with the recovery broth or speaker sip. If you're sipping now, take a moment to hold the mug,
Breathe in the warmth. Notice the sound of your throat settling. This ritual matters because it signals rest and care to your nervous system.
Before we close, quick recap. 1. Learn the red flags and seek care when they appear. 2. Use the speaker sip, saline mist, and short-run broth as short-term conservative supports. 3. Warm up and pace your voice. 4. Run the 7-day microtrial and bring those notes to a clinician if symptoms persist.
Jordan, Maya, any final encouragement or parting wisdom for our listeners who live by their voices?
Your voice is your instrument and your mirror. Small, consistent care matters more than dramatic fixes. Start small, build reliable routines, and get help early if things aren't improving. You've got this.
And clinically, be precise when you describe symptoms and timelines. That helps us help you faster. If breathing is affected at all, seek emergency care.
If you want the printable tracker, exact recipes, dilution math, and clinician phrases, they're in the show notes. Try one demo before your next heavy voice day and observe how your voice responds.
We'd love to hear how it goes. Tag @EarthyRemedy with a photo or a 15-60-second voice note. Tell us which demo you tried and what changed. And remember our signature. Listen to your body. Trust the earth. Feel the difference.
Thanks to Jordan Lee and Dr. Maya Rios for joining us, and thanks to you for listening. Subscribe so you don't miss the printable resources and future clinics like this one.
Until next time, slow, steady care for your voice and your body. You've got this.